are more likely to develop osteoporosis? Women, I know you said specifically there's age that's factored in, gender, family history, but really who do you see at a higher risk of developing the osteoporosis?
Definitely women starting in their 60s,
Okay.
who were not taking estrogen replacement.
Okay. And now we're going to switch gears to that hormone replacement therapy. And at what point do you advise your patients, hey, let's start this, let's see how this goes?
Well, you know, I counsel every patient on the pros and cons of estrogen, and I make sure that they don't have any of the absolute contraindications to estrogen, things like a history of a thromboembolic episode or history of breast cancer or uterine cancer. As long as they don't have those contraindications, then I just explain to the patient the pros and cons of taking estrogen.
I think it's interesting to note that hormone replacement therapy was something that was actually introduced in the early 1940s, but because of a study published by the Women's Health Initiative, there was a bit of controversy. So can you explain what it was, what happened, why that sort of went away and was kind of a little bit frowned upon, but now it's continually being used to treat?
So the WHI study was initially published in 2002, and that was a randomized controlled study that enrolled over 27,000 women. And its purpose was to look at the effects of estrogen and hormone replacement therapy on things like bone health, heart disease, breast cancer, uterine cancer, colon cancer, and death. And what they found was that there were positives and negatives for estrogen. I've often heard the WHI study being compared to King Kong.
Right.
Initially,
that panic,
very scary, everybody up in arms with their pitchforks. But once you get to know the WHI study and you look a little deeper, you realize that it does have some benefits that patients need to be aware of.